Man first came in contact with fire through lightning striking the earth, and he learned to utilize fire for heat, light, and tool making. Later, man learned to make steam-powered vehicles, and ultimately to make steel. At Burns Harbor Steelmaking, we manufacture and process over 15,000 tons of steel every day. We are in close proximity to heat and flames reaching up to 3,000 degrees Fahrenheit. We suffer from flash burns, spark burns, and worst of all, full molten contact burns. Most times we get lucky and the burns are a minor inconvenience, only calling for a trip to the clinic for a tetanus shot. But sometimes it's worse, and you have to spend time in the hospital, undergo skin grafts, or you may die. So what do you do to protect yourself? You wear flame retardant clothing and the best available safety equipment, but mostly you use your head. Recently, a flammability test was conducted to determine how long certain materials would last under high heat conditions. Wooden supports were used to hold up different items of clothing. All were subjected to radiant heat ranging from 200 to 500 degrees Fahrenheit. As you can see, blue jeans and old washed greens go up in about 5 seconds. Nylon and polyester melts in 8 seconds and ignites in 1 1/2 minutes. Old wool and cotton takes 30 seconds to ignite. The new unwashed greens never actually ignite. They smoke and smolder. And the aluminum coat does not ignite at all. Now, can you imagine what it would feel like if you were inside any of these? No? In that case, you might be interested in hearing from someone who went through the ordeal of having his clothes on fire while wearing them.
My name is Phil Griffith, and I'm Deputy Fire Chief for the City of Valpo. On July 3rd last year, which would be 1986, I suffered second and third degree burns over 22% of my body. We were at a training session. It's one of them situations where nothing is supposed to go wrong, so your guard is down. It's so familiar, nothing can happen to you. And what had happened, we had lit a house on fire on purpose. I had 3 or 4 rookies who had then at this time gone in and tried to put the fire out. After they had the fire out, they'd come back out and they said, well, okay, that was really neat. We made some mistakes, let's try it again. So, being a training session and familiarity breeds contempt, I got up, walked into the house, left my protective clothing laying out in the yard, proceeded to dump kerosene gasoline mixture throughout the room. As I was dumping it, I turned around and I saw a burning board fall from the 2nd floor. I knew I was going to get hurt at that point. There wasn't a thing I could do about it. So I protected myself. I threw my hand up in front of my face. I took a deep breath because knowing in that type of temperature range of 900 to 1200 degrees, if I breathed, it was all over with. I would burn my lungs out. I would be dead at this point. After I felt the initial explosion knock me down, I then had already located all my exits and everything in my head and headed for the doorway. I knew if I followed the railing along this old stairway, I'd get to the back door. And this is part of being a survivalist. I knew what I was going to do. I knew ahead of time, and I rehearsed it in my brain many, many times, but I'd never had to use it. Once I hit the doorway, I hollered out that I was on fire. I hit the ground, started rolling. I did the stop, drop, and roll technique that we've taught kids to use for years, and it does work. I also had 2 firemen who were standing outside there that immediately opened hoses on me to try and cool me down. The weirdest part about the whole thing was everything went in slow motion. As soon as that board started falling, everything slowed down. And what this is caused by is your brain, adrenaline, your brain starts speeding up, and it slows everything else down. As soon as they hit me with the water, everything moved back to normal speed. Another weird part of it is there is no pain when you're on fire. Being on fire is like having a whole bunch of people scratch you. In fact, it's not unpleasant at all. And initially, I didn't think I was hurt. I tried to get up, and one of the other firemen grabbed me and said, "No, lay here." And I said, "No, I'm fine." I said, "Leave me alone. I'll take care of myself." I said, "Any minor burns I'll take care of with my first aid kit." And they said, "No, you lay here. You're hurt." And I said, "No, I'm not." So I pushed him away, and I tried to sit up. When I tried to sit up, I noticed that when I looked down, all my clothes were gone, and I had all this meat hanging from my right arm, and I thought, boy, I really am hurt, but I just don't know it yet. So I laid back down, and again, there was no feeling of pain yet, and I could hear the sirens from the ambulance coming in the distance, and as it got closer and closer, then the pain started to build up. I've had broken bones, I've had bruises, I've had cuts. I have never had pain like this was, and it's about 5 to 6 minutes after the fire that the pain really set in. I started out of teaching instinct. I told the guys there, I said, start taking notes of everything I tell you. And being a training session, we also had a photographer there who had been taking pictures this whole time. So we had some good pictures at the scene. I wasn't really sure how long I was going to be able to take it without going into shock. So I started telling them, everything I was experiencing. And in the ambulance, I did the same thing. Once the paramedics got there and they got their IVs started, and we were on our way to the hospital. And this happened on 49 south of 30 in Valpo. Well, as we passed Azars, I remember seeing Azars. I don't remember anything else from that point on. Once we got to the emergency room, I started realizing exactly where I was, and the paramedics said, well, at Azars you went totally shocky. You weren't relating anything that was happening anymore. And in ER, my biggest fear was not that I was hurt, but that I had no control over my entire life at this point. I could feel the pain, and I could see nurses who I had worked with on rescues and through ER for 15 years. Now all of a sudden I couldn't recognize them. I could hear their voices, I could place their names, but I couldn't tie the name to a face. And I had no control over my entire life. I was going into shock and then coming back to reality. And then I go back into shock and then come back to reality. And like I said, the biggest fear was not having any control at all. Here they've already got me stripped. A nurse I've known for 15 years is putting a catheter in me. That's embarrassing enough as it is. And then I would start getting shocky again, and the 3 nurses were talking to me, and I couldn't tell which one was which. The thing that helped me the most is one of the paramedics came in. Now, he's dressed in dark gray. The nurses are all dressed in white. He's different. He stands out. So I focused onto him, and this brought me back into reality. So he started to leave, and I started to lose it again. So I hollered out to him. I said, Gary, you got to stay here. I said, otherwise I'm not going to be able to hold on to myself. What's going on? And just the fear of not having anything to control. But by me telling him, you're staying here, and him doing this, I had control over one small aspect of my life. During the first, probably 15 to 20 minutes of that I realized I was in the emergency room, and I started to have that control to maintain sense of what's going on around me. The pain was so intense that I would try to eliminate the pain with my brain, and it wouldn't work. And I kept saying, well, give me something for pain. They said, we can't do that until we find out the extent of your injuries. Now they're up here with needles poking around in the burn areas to find out which areas are third degree, which areas are second degree. Because third degree burn areas don't hurt. The nerve endings have been destroyed. It's the second degree area that hurt at this point. So once they determined that, then they gave me a shot of morphine. And I can truly understand why people become addicted to morphine. Because it doesn't eliminate the pain. It takes you away from the pain. And you don't care if you hurt. Well, then after that, they told me that they were going to take me to a burn center in Fort Wayne. They had the helicopter on the way. And I'm going, I don't think I want to go clear to Fort Wayne. There's nobody I know in Fort Wayne. I'm looking at an extended stay in the hospital. So Dr. Retson, who was my plastic surgeon who came in at this point, he specializes in burns and reconstruction. He came in and he says, if you'll do everything I tell you with no variations, I'll keep you at PMH and you won't have to go to a burn center. And I said, no matter what it is, you got it. So then he laid out the guidelines of what we were going to do. First thing we had to do is we had to go through a debriding session. And if you understand what the word debris is junk. Debridement means that they're going to remove the junk from your body. Well, they take me over and they put me in this Whirlpool tank. And it's 440 gallons of 100-degree water. Now you're putting a person with burns into 100-degree water. Gives you an idea what that feels like. Then they dump 2 quarts of betadine into this. Then they turn the Whirlpool jets on and they would whirlpool you. Now they're whirlpooling my legs at this point, and then they would pull this up and they'd direct whirlpool jets into the burns on my chest area to try and bring any of the dead tissue to the surface. Plus it kills any germs that are on my body, which prevents infection. After about 15 minutes of the whirlpool session, you can see the other technician here, she would pull me out of the water, basically, and she took a 4x4 sponge and now she's scrubbing down the burn areas. And it is extremely painful, but what they're doing is they're taking all the dead tissue off and trying to wash it away as much as possible. I had the advantage of understanding what was going on. They let me do some of the washing of the second-degree burn areas. They wouldn't let me wash the third-degree burn areas because they knew I would not scrub them the way they should be scrubbed. They'd rub all this dead tissue and stuff off, then they'd drop you back in the tank. Whirlpool you for another 15 minutes, and they'd pull you out, and the technician would get down with a pair of tweezers and scissors, and he starts pulling the dead tissue off. And that dead tissue that won't come off, they cut off. And everybody says, well, what does debriding feel like? If you want a good idea what it feels like, you take a razor blade and you put a cut on your skin. Get yourself a pair of pliers, grab a hold of that skin, and pull it off. That's exactly what it feels like. Here, the other technician, now she's starting to smear this stuff on my arms. During the photo session, we used a little bit too much time and my pain shots were starting to wear off. And normally they use a nice tongue depressor and they smooth this on all nice and neat. But here the skin was open to the air. And this is day 7 of the burns, so the third-degree burns are starting to get their nerve endings back. Well, if you've ever chipped a tooth and sucked air over the top of that tooth and know how that hurts, well, I have millions of nerve endings open to the ear right here. So she's just sticking her fingers in this. She's got sterile gloves on, but she's grabbing this Silvadene solution and smearing it on to shut the ear off to eliminate the pain, because I was in a lot of pain at this point. The pain is unbelievable. It's tough for me to sit here and explain to you what it is. Now, working with burn patients before I was a burn patient, I kind of knew what they went through. I didn't understand what they went through. Now I understand. Now you take somebody who has 60, 70, 80% of their body burnt. Now mine's only 22%. Mine was minor compared to theirs. So I was asking the doctor, I said, well, how is their pain compared to my pain? He said, pain is pain. He says, the body will only take so much pain before it passes out. He says, they hurt like you hurt. The only difference is you're not going to hurt as long because you aren't burned as bad. Where I was out of the hospital after the skin grafts and everything else in 5 weeks, they're going to be in there maybe 3-4 months. My burns are going to take 18 months to heal. Their burns are going to take maybe 24 to 36 months to heal. Depends on the deepness of the burns. Now, I had first and second degree burns to my face, from my ears, all the way down to my knees. And I went through the debriding twice a day for the first 15 days, and 9 a.m. and 2 p.m. And from 9 a.m. until 5 in the evening, I was not worth talking to. It was just, the pain was excruciating. And they said, well, didn't they give you pain medication? Yes, they did. I was on morphine the first 3 days, and then I was on Demerol for the next 10 days, and then I was put on Tylenol number 3, which is like taking 2 aspirin before you go into the debriding tank. They don't want to put you on too much of the pain medication because you become addicted to it. So they try to wean you off there as fast as possible. If a person has like 90% burns, they can't give him the pain medication because pain medication will cause his body fluids to seep out faster. So it's a whole nother world when you're dealing with a burn. If you cut yourself and it's healed up in a week, or you cut yourself really bad and they sew it up, a week later they take the stitches out and it's almost healed. My burns, now this is June 1st, and I still have trouble with my burns, which is almost a year later. In the morning when I get up, my arm is in a contracted position. I actually have to force it down. And then I pick up a bowling ball and I carry it around to help tear all the little scar modules free so that I can use my arm again. I have 100% use of everything, provided I don't forget to use it. If I would lay there and just keep my arm like this all the time, it would heal in this position, and I'd have to go through surgery to straighten it back out. So I do have therapy every day as far as working this arm. So, one thing I can say is we've developed a burn slide program out of these pictures to help educate firemen in how familiarity breeds contempt and the importance of that protective clothing. We take everything for granted. We work so often with a certain area that we say, well, it's only going to be a minute. I don't have to worry about my gloves. Or it's only going to be a minute. I don't have to worry about my coat. Or I don't have to wear that protective breathing apparatus here. I don't have to do this. So we're working it there. And we're also working with the lay people to help them understand that, yeah, you can't give that fire a chance, because if you give it a chance, it's going to take it. And where you're going to have to work with your people out here is, yeah, familiarity breeds contempt. They work in this area so often. They say, I don't have to worry about it. I'm immune to being hurt because I've been out here for 15 years. Well, I've been a fireman for 17 years. I was a fireman for 16 and a half years when I did that. And I knew better, but it's only a training session. Nothing can go wrong. It's only going to take a minute. Nothing can go wrong. I was on fire for 7 seconds. I don't ever want to have to go through that again. The pain is unbelievable. And mine were minor compared to a lot of people. If you got 80% of your body burnt, you're looking at 2 years of your life is down the tubes while you're trying to get back to where you can even walk around and talk about it. So it's not worth the effort. Take the time to put on that protective clothing. Take the time to wear your safety glasses, even though you don't like to wear them. Make sure you have everything before you go out and work in your area. Don't take the chance to do it without it.
We here at Burns Harbor Steelmaking are fortunate. Most of the burn injuries over the years have been minor, with an occasional injury of near serious proportion. We have had only one fire-related fatality. This is due in part to luck, but in a greater part to experience, common sense, and the use of safety equipment by the workers. Let's face it, we tend to take the danger for granted with thoughts like, it won't happen to me, or it will be just a small burn. Can you afford that chance? Do you want to go through skin grafts, time in the hospital, all the possibility that you may die? It's up to you to wear the fire-resistant clothes,
watch the flames, but most of all use your head, or you may leave the plant like this.